Healthcare tech is having a moment. So
Yeah, they are.
I'm gonna have kick this off to you because you were in the keynote with Larry Ellison from Oracle. I was not. You guys got like a special little room, you and Matt, um, on day one where the rest of us weren't there yet. Tell us about kind of the company's move to Nashville, but also and kind of what that signals, but also just what he talked about and the importance of their investments in healthcare.
Yeah, so I saw Larry actually. He was at Oracle Cloud World last year in Las Vegas, and he was in the room the other day, actually on video in the room. But he he's so flamboyant and so interesting to talk about, and so passionate. He grabs your attention so quickly. He has a love for the healthcare industry and also the agricultural industry, and he's trying to find a way to streamline how we can cure certain diseases or utilize AI and data, of course, and actually AI to help the data, uh, work in a way that it should to pair different things together from I guess a testing and methods to moving trials up and utilizing the performance of doctors and how they can be more efficient. So he is wanting to go to Nashville, and there's a healthcare industry hub there. There's a lot of major companies there, and there's major medical centers there as well. But he some of the things that he talked about is how to make doctors more efficient, kind of going back to what I was saying, that how AI can interpret the notes from a client patient session and then bring those notes back into saving the doctor 20% of his time, to taking the trials and advancing those based upon re-indexing things to take those trials to the forefront. So companies that are waiting in line for years and years to get their trials seen and tested, that they could actually understand this by the indexing of the data, where they could be seen a little bit sooner and then curing certain types of cancers, because that's one of the ones that he's very focused on. But he wants to take this advancement and have some dedicated centers from an industry perspective in Nashville. And Nashville was picked for those reasons that I talked about. But I think this has been in the works for quite some time, and it looks like it's going to begin construction soon, but the offices were going to be operating probably, I think, towards 2030. But what's your thoughts on this?
Well, it definitely healthcare came up a lot in the different tracks that I was in. So in CRM, HCM, CX, healthcare kept coming up as, the sort of like the example or the demo or whatever. And in some cases it was the first sort of vertical that they built a solution for. And there was some really interesting data points. And one of them, and I can't remember which track this was in, but one of them was one there was a bunch of different like scheduling tools and things that really help with these frontline workers and solving some of the real issues that we've had over the last few years, with frontline workers and burnout and all of these things. But one of the things that they uncovered was that AI, when tested side by side with a brand new medical school graduate, knowledge base, they were similar. So, that's great. Our medical school graduates are just as smart as AI. But from a bedside manner, the AI actually came out higher. And the reason for that is AI doesn't get tired. AI doesn't have a bad day. It doesn't get moody. I mean, so there are some real things that we can learn. And I think I talk about
Yeah.
this a lot, that there's so much more to AI than productivity. There's the things that we can learn from it. And you were talking about these, like the medical trials. AI may pick up on some patterns that humans may miss. And
Mhm.
even from like a symptom standpoint, if I have, I have an eye infection and I have this thing that hurts my knee and I have this and that, all these ailments, that a doctor may never put them all together, but AI may
Yeah.
actually put that together. And so there's ways that AI can really help from a healthcare perspective.
Mhm.
Um, so,
Consistency.
so yeah, I mean, clearly Oracle is making a huge investment in healthcare, and I think always has. One of the executives that was doing one of the demos, I asked, why are you starting with healthcare in this particular product? It was an HCM product. And he said, well, anything healthcare, anything that gets beaten with the healthcare stick gets priority around here. So, clearly Oracle, is very dedicated to healthcare. But, I mean, I've just noticed this is a trend lately in general. Recently, PayPal launched an integration with a digital wallet integration with a healthcare provider. Um, PayPal did a study that found that 50% of PayPal users and 42% of Venmo users said that they would pay their healthcare bills faster if they had a way to do it through using PayPal or Venmo. So, like when they get a bill in the mail, this partnership is with Trust Commerce. Ring Central just recently announced a unified patient care solution for healthcare organizations. So this is like a pre-built integration with like major EHR providers like Epic and Allscripts. I just keep seeing this across like pretty much every vertical that I cover. It's like, oh, this solution for healthcare. And when you think about it, historically, healthcare is a clipboard industry.
Hmm.
And everything has been done operationally. It's very manual, even scheduling. Nurses and doctors are scheduled, and a supervisor has to go in and log it and approve it. And now there are solutions that are automatically scheduling and or at least digitally scheduling and digitizing records so that pharmacies can talk to each other and um, you know, uh, just recently, 8x8 announced their solution for proactive outreach, which allows for companies to send patient reminders.
Hmm.
And so we're talking about, product, what a product does versus what a product does for you. When people get a text or a WhatsApp patient reminder, they're less likely to no show. So that doesn't waste a doctor's time and, lost revenue. So just across the board, I think the digitization of the healthcare industry is better for doctors and it's better for patient outcomes.
Yeah. Well, there's also been many compliance and regulations, that have taken it to a different level, which is always needed. But at the same time, all these things that you're talking about make it more efficient to, in the end, allow for the focus on better medicine, right? And that's what we all looking for. So
Yeah.
the average age of living is longer, but we want to see those people, who aren't living as long get the treatment that they should to live that long. So that's a big deal.
Yeah, and I think, you raise a really good point about the compliance. So I think in the past with things like HIPAA, there wasn't a secure way to transfer files, say from one doctor to another. That's why we used to have X-rays being hand
I was
delivered
ready for you to say that.
from a
Yep.
doctor to doctor. Now, with better security, they can actually be transferred electronically. So as we have better security, better digital security, better cybersecurity, these records can be shared across different, doctors and health records can be shared with permission, obviously. So I think that's a really good point.
It's a game of inches though. When someone's sick, they need this information and they can't wait. So all the efficiencies that
Absolutely.
Oracle's trying to do are huge for the long term. And kudos to him for putting such an effort into healthcare and taking it to a different level. But what do you think of the actual city of Nashville as far as this taking place?
So I love Nashville. And there's been a lot of movement to Nashville. I know they got a major tax incentive to go there, but
Hmm.
also I have heard from several people who have been there for different reasons for healthcare, and have said great things about that. Um, It'll be interesting what happens to the real estate market, just like what happened to Austin, where I live, when the big tech migration happened. So, we'll see about that. I don't know what their mandate is from a return to office standpoint. It seems like they're pretty flexible with their workforce. So, um, I don't know. We'll see. I think from a city standpoint, it's great. I mean,
Yeah.
it's a great place to live. It's a booming city. Hopefully, the cost of living doesn't go up too much, because that's not a great thing for people's health either.